Scents are contained in a wide variety of products that we use, such as shampoo and conditioners, hairsprays, deodorants, colognes, and aftershaves, fragrances and perfumes, lotions and creams, potpourri, industrial and household chemicals, soaps, cosmetics, air fresheners and deodorizers, oils, candles, diapers, and some types of garbage bags. It is very common for people reporting reactions to these scented products to also report reacting to many other substances such as building materials that give off volatile organic compounds, combustion exhaust from cars, trucks, etc., and cigarette smoke. If your workplace, place of worship, community group, or organization is considering a scent-free program, here are some things to consider when developing a program. Conduct an assessment or survey to determine the extent of the problem. Collect opinions and suggestions at the same time to help you develop a program appropriate to your workplace. Designate one key person to oversee the project. If you work at a large company, it may be better to create a committee with members representing all groups, employees, unions, management. Involve the Health and Safety Committee and get management commitment from the beginning. Set and stick to deadlines for creating a draft program, a review of the program, and for implementation. Do not limit the scent-free program to just perfumes and colognes. As discussed earlier, many personal care, cleaning, and building products also have scents. Make a list of unscented alternatives and where they are available locally. Review all material safety data sheets, MSD sheets, for the products currently used and for those you are considering using. Make sure that the ingredients are acceptable. Remember that some products that claim to be scent-free may be using additional chemicals to mask smells instead of truly being unscented. Develop notices that floor waxing, carpet shampooing, painting, or spraying will be conducted 1 week beforehand so that affected personnel can make arrangements or have their duties modified during that time. Put information about the program on all materials, appointment cards, stationery, room booking notices, employment postings, etc. Decide on wording for scent-free or scent-reduced signs and where the signs will be posted. There are examples of signs available online. One workplace that introduced a scent-reduced program is River Valley Health. River Valley Health represents approximately 20 facilities in New Brunswick. Shelley Fletcher is the Director of Communications.
In 1997, our hospital corporation responded to complaints from our patients and as well as from our staff and implemented a scent-reduced environment. What that meant is that we informed all staff, patients, physicians, and visitors that when coming into our facilities, and we have a large organization, over 20 sites right now, that they're not supposed to be wearing any scented products. The reason for doing this is that staff were encountering patients that were coming in for appointments that were scented and would have a variety of reactions to them, but sometimes could be severe enough that that staff member had to remove themselves from the appointment and either get a replacement, or if no replacement is available, they would have to reschedule that appointment. So that's a loss of staff productivity, and it's also an inconvenience to the patient. Also, patients are in this environment because they're already unwell, and we want to promote health. We don't want to present them in an environment where something may negatively impact their health. So this policy was put in place to be able to protect our staff and our patients and those visiting our facilities.
Programs should be based on the health concerns of the people impacted, especially those who have sought medical help. Keep the program information short but specific. The program should apply throughout the organization. Shelley Fletcher describes what's involved in their program at River Valley Health.
The key to implement a scent-reduced environment is through communication, making everyone aware that we have a scent-reduced environment and that we don't want anyone wearing scents when they come into the building. The way we do that is through a constant communication by signing our buildings and letting people know this is a scent-reduced environment and to not wear scented products out of consideration for those who have allergic reactions to them. We do promotional campaigns frequently to let people know before they come into the building that this is an environment where you're not supposed to be wearing scents. We include that as part of our staff orientation when people are being hired. We also include that in the information that people receive before they come in for their appointments or before they come in for their admissions or their surgeries. And therefore they know that when they come into the building they're not supposed to be wearing scented products. The challenge with that is that doesn't always happen 100% of the time. Some people do come in wearing scented products, and that might mean that that individual needs to come back at another time. If they're having an appointment with a staff member who's highly allergic to scents, it may be that that patient needs to go back and come back at another time when they are not wearing scented products. For a staff member, if they're wearing scented products and a complaint is issued, whether from a patient or a fellow staff member who has allergic reactions, it might mean that a manager needs to sit down formally and speak to them, and that this is noted on their staff file. One of the challenges with our policy at this point in time is that it's only scent reduced. There is some room there, and it also prevents us from a stronger enforcement than if you had a scent-free environment. We are considering this. We have spoken with a hospital that has a scent-free environment and for quite some time, and just asking their advice about how we might do this, how we could implement this, and this is the next step for us. And I think eventually it will be the next step for us. We will move from the scent-reduced environment to a scent-free environment.
When you launch your program, ensure that you educate everyone involved. You may choose to include brochures or flyers in payroll envelopes, publish articles in company newsletters, or give presentations. In any case, the goal is to inform everyone involved of the health concerns related to scents and why the program is needed. Make it clear that the program applies to everyone, including visitors, patients, etc. Address any concerns raised openly and honestly. Let everyone know that the program will be reviewed and can be changed because of experience or new knowledge. When a program is introduced, signs should be posted near entrances. In addition, statements on business cards, letterheads, or promotional materials may be helpful if you receive a lot of visitors. As you've heard, scents are a concern for a number of people and are being addressed in workplaces and other organizations using a variety of approaches. If you, your workplace, or organization would like more information on ways to improve your air quality, please contact the Lung Association at 1-888-566-LUNG or visit our website at www.lung.ca. It just makes sense. Here are some websites that may be helpful. The Canadian Centre for Occupational Health and Safety at www.ccohs.ca. The Canadian Health Network at www.canadian-health-network.ca. The Environmental Health Association of Nova Scotia's Less Toxic Guide at www.lesstoxicguide.ca.